Welcome to Clerkship Paradigms, your travel guide to the third-year clinical clerkships. In this series, we discuss the approach to patients and the tools you need to be successful in each specialty. After completing 2 years of medical school and Step 1, you have already compiled an impressive amount of knowledge to put into your toolbox for your future as a doctor. You've learned the signs and symptoms, the diagnostic tests, and many treatments for most of the diseases you will see on the wards. The clinical years are about a lot of things, but a key skill that you will develop is clinical reasoning, organizing information, developing a differential, and letting those inform your plan. Within each rotation, you can practice these skills by organizing clinical information into discrete, complaint-specific drawers that you can draw from based on which specialty you are in. Unfortunately, every rotation of third year is not the same. You will inevitably have trouble recognizing the shifts in patient care priorities between specialties. That is to say, we need to appreciate the unique paradigm that each specialty uses to approach patients. The goal of these videos is to help you reduce the adjustment period when starting each new clerkship. We hope you will watch the corresponding video before starting that clerkship to gain a better sense of what to expect from that specialty, so you can hit the ground running from day one. Try to use these videos like a roadmap to the clerkships. While you eventually won't need to carry a map to navigate each specialty, when starting out it is helpful to have a guide for how to use the information presented in that specialty. Each video will describe the inherent features of that specialty that make it unique, as well as identify the challenges that arise in learning to approach patients within that specialty. We will then provide solutions to those challenges in the form of content, the knowledge you need to master, process, the clinical reasoning you need to apply, and differential, the possible diseases you need to visualize. These solutions are the clinical reasoning skills we develop in that rotation, which can then be applied across specialties. Overwhelmed? Don't worry. The good part is you get to do a deep dive into each specialty for weeks or months at a time and solidify the core approaches that work for those types of patients. The tough part is making that transition between specialties as a learner. You'll be far better off starting the next rotation if you already have an idea of how to adjust your approach and understand how each specialty is unique. Thanks for watching Clerkship Paradigms, your travel guide to the third-year clerkships. Please fill out the post-video survey and tell us your thoughts. Good luck on the wards.